Dr. Letitia, welcome to the Tick Bootcamp podcast.
Thanks so much. It's exciting to be here.
Well, thank you. We're excited to have you as well. So can you first introduce yourself to our community, give them an outline of where you're currently working, and a little bit about your background.
Sure. So I was originally trained as a surgeon, actually. So I'm a medical doctor, physician, and I was trained as a plastic reconstructive surgeon and hand surgeon, and I did mostly reconstructive work and insurable things.
Oh, that's interesting.
Yeah, so I've always been kind of interested in helping people get better. Now, working with chronic illnesses, I'm looking more into anti-aging, but I was really more of a reconstructive surgeon than a cosmetic surgeon as a plastic surgeon.
Well, that's an interesting path. So how does one go from where you started to where you are now in the work that you're doing now?
I was in private practice in Connecticut. I was on staff at Stanford, Greenwich Hospitals, and then Yale. And I was working about 100 and 105 hours a week, and it was a lot. So I took a break from surgery, and I got involved with a number of different things, included being the executive director of a nonprofit that was looking at rare genetic disease genes through a kind of a yeast analysis. And then from then went on to be involved with the board of the mothership company, so to speak, which was kind of looking at drug discovery, but in the way of finding novel pharmaceutical agents and also repurposing pharmaceutical agents for things like, the pandemic, for example.
Okay.
And and then as part of this, along the way, I basically experienced, about many of your listeners' experience, is that I had been developing symptoms and had actually had symptoms for a number of different years. And being a surgeon in those days, I didn't know that much about medicine. They're actually very, very different lines of training. And so I was very good about cutting things up and putting them back together and knowing the anatomy of things.
So you're more of an engineer than a traditional
I was
physician,
in those days, sure. I've learned a boatload of medicine since, so I've had a whole new training. But in any case, so I had gone to see an internist who had been recommended to me, and I was told I was normal. And the range of normal, is a certain bracket, and I was like maybe 0.1 off from abnormal. And I said, I have 10 out of 10 symptoms, and I'm just like a fraction away from the abnormal. And I was told, you're normal, and was sent out the door.
Wow.
Yeah.
So you're living in Connecticut, right? How long were you in Connecticut before you started to have these symptoms and you found yourself with a doctor who was not capable of helping you to diagnose your illness?
Well, honestly, I probably had those symptoms since I was in medical school. In the surgery, I would take care of burn patients where they would crank up the temperature in the room because burn patients lose a lot of fluid and you have to keep their temperature up, and they'd have heating lamps, and I would wear my long underwear under my scrubs because I was cold. So I had like symptoms of hypothyroidism for years. And even though I'm a doctor, I was actually a pretty good patient, and no one ever checked those labs, even though it's just like one little check off on the Quest to the LabCorp slip.
Yeah.
And but then, as what happens with a lot of people is just like always like some extreme stressful event that then can kick things off. And I was also, a hiker, very active outdoors, living in the Northeast, and I had contracted Lyme 3 times that I was aware of, inadequately treated.
Acute Lyme.
Acute Lyme,
Yeah.
sure.
Yeah.
And now I know, being involved with ILADS and in the world I'm doing now, treating now, is that I really wasn't treated adequately in those days, and so.
Share with me what the treatment was. Was it just a short course of antibiotics?
It was a short course of antibiotics, and then even a couple of times was where they gave me like 2 doses of antibiotics. And the problem with that is that it's inadequate to treat any of the tick-borne diseases.
Right.
But then it can make your system, basically make your antibodies not respond to a test. So now you have Lyme, but you're showing that you're not on any tests. And so it's a double whammy of not good, of outdated medical care, essentially.
The interviews like this that I'm doing with you scare the heck out of the patient community. And the reason it scares the heck out of the patient community is you're clearly brilliant. you're very articulate, you're a medical doctor, and you were doing high-level work, but you were not trained enough to even diagnose yourself. I mean, you're living in your own skin, you're feeling everything you're feeling, and you didn't have adequate training as a medical doctor to even diagnose yourself. And then you were going to colleagues who, of course, are going to work overtime to try to help you overcome your illness, and they couldn't diagnose you either. I mean, that's a pretty scary phenomenon. Do you agree?
I absolutely agree. And not only that, I really often think like, oh my goodness, here I have the capability of ordering tests or prescribing, certain things to myself. And I can only imagine like the frustrations that I feel within the medical system are, 1,000-fold for patients. And it's really that kind of motivated me to completely change course and do what I'm doing now.
So talk to us about that. So you saw the flaws in the system as a patient, not as a doctor, but as a patient, and now that caused you to go through a career change, or at least, I don't know if I'd call it a career change. I mean, I'll let you describe it, but certainly a change in focus on the work that you're doing.
Yeah, so after this experience where I was essentially blown off, I'm just going to say that by this practitioner, I actually went to a hairdresser who was about 70 years old, and she started poking at the sides of my hair and said, you have a thyroid issue. And I was like, what? I don't have a thyroid issue. That's where I wear my barrettes when I exercise. She goes, no, you have a thyroid issue. So I literally go home and read about what tests do I need to do. And I did the test myself. And not only did I have a thyroid issue, but I had an autoimmune disease where I had antibodies against my thyroid. And when you look at those levels, they basically say that anything over 700 is severe, and mine were 1,400 and something. So I was like crazy. So I was like full-blown hypothyroid, but it was full-blown autoimmune disease. So as I was waiting to see an endocrinologist, and I really knew very little about hypothyroidism, although now I manage all my patients' thyroids, I started reading, and it was like, oh, if you have thyroid, you should go off of gluten. So I went off of gluten, and I'd come out of a very traumatic, deterioration of a marriage and divorce, and that was my big stressor that probably really, really kind of kicked off everything. And I'm generally happy spirit, and yet I was suffering from this kind of low-grade depression, but it was 4 years later, and I was on vacation. I'm just like, what is going on? And if you can believe it, going off of gluten, 6 weeks to the day, the depression went away.
Really?
And it has not returned, and that was 7 years ago. And so, and then I went to see an endocrinologist, and again, I wasn't really honestly treated as thoroughly as I should have for my thyroid even. So as I started reading more and learning more, and I got into the world of functional medicine, I saw some wonderful practitioners. I started thinking, gosh, you know what, I can do this. And I have a medical degree, and I have this tremendous opportunity and really responsibility to help others who are suffering. And so that's what brought me into this world.
Oh, that's really cool. Well, thank you. Thank you for making that pivot. I'm sorry you had to go through so many emotional and physical challenges, but I'm glad you're here. So talk to us about how you're now helping patients. What's unique about your approach that you weren't trained to utilize during either your medical school training or your post-medical school training?
Yeah, so what I find is that there are so many people out there that have these like chronic ongoing symptoms. They can be quite severe, and I really believe that our world is really poisoning us. Our world is toxic with all the chemicals the foods and the environment and our cleaning supplies, our personal supplies. And I see so many young people. I had like 3 young women in their 20s who really were mostly bedbound for 2 years before I ever saw them. So, you have these patients that can be very sick or just these ongoing things. I think there are a lot of patients that don't really understand or appreciate maybe how well that they could feel in general. And so I started really wanting to help people get better, and ended up kind of getting trained. I was trained with a number of different institutes that went the route of functional medicine, which is looking at what are the root causes of disease. Let's address those, not just treat symptomatically, whereas conventional medicine is great at dealing with acute injuries. If you break your leg, you need to have a cast. If you have a heart attack, you want those people on board for you, right?
For sure.
But chronically and alive, and totally compassionate towards medical doctors. Heck, I am one. I was trained to one. When you're only seeing patients, one every 10 to 15 minutes, you don't have time to really investigate these. Like I have yet to spend less than 3 hours on any new patient visit because it takes that long to get a thorough history and understanding of all the issues that are contributing to their health or their illness. And so I started, really focusing on that. How can we make patients better? And in focusing on that, it's like, all right, well, you can't look at the whole body health and not look at hormones. And you can't do this and not look at adrenals and stress. And then that impacts hormones or thyroid, and everything's interrelated. And then gut health. And oh my gosh, that's contributing to the cognitive issues and the mood issues. And so over time, just one thing after another, I've just trained more and more. And what I found is certainly living in New England, but really it's anywhere in the US and possibly anywhere in the world, is that you can't neglect tick-borne diseases. And then everybody has a chronic virus of some sort. And then on top of that, now we have the huge issue of long COVID and post-vaccine issues.
Yeah, so tie those two together for us here now.
Yeah, so I personally don't get political when it comes to COVID and the vaccines. I think at the end of the day, what matters is that how do you get that spike protein in you? And it's the spike protein that's toxic. And I was quite fortunate to get introduced to Bruce Patterson at Stanford University and his team early on in the pandemic. And I was one of the doctors who would meet monthly to get presented the data. And since then, I have consulted with him and his team, a number of times with my patients, and I'm very, very up to date with his research, as well with other practitioners' protocols out there. But what I find is that Dr. Bruce Patterson and his team's approach, it's based in science. It's super exciting, and basically what happens with the spike protein is it gets retained in one of the white blood cells called a monoclonal monocyte, and then with that spike protein being retained, normally that white blood cell should die in about 5 to 7 days. But instead, the dying mechanism, or the apoptosis of the cell, gets turned off. And so the cell remains activated. And in this activated state, now it's going to secrete and cause the body to secrete what are called inflammatory cytokines. And those inflammatory cytokines are now going to cause a lot of symptoms like brain fog and fatigue and joint pain, whatever the symptoms are, insomnia. And then on top of that, one of the first primary mechanisms that happens is that the platelets get activated. And you activate what's called the thrombotic pathway or the coagulation pathway. And that creates a thickening of the blood, essentially. And so these activated cells bind to the blood vessel walls, and that causes this vascular inflammation. And then on top of that, the vascular inflammation plus the activation of these platelets, this thrombotic pathway creates this thickening of the blood, and now this thickened blood can't get through the little tiny tributaries, capillaries to perfuse the brain, and that can cause mood issues, it can cause brain fog, cause muscle cramps and fatigue. But on top of that, that's what's causing a lot of the atrial fibrillation that's going on these days, as well as the strokes, even in young people. And I think that in the conventional medical system, people are saying, oh, here, you have atrial fibrillation, we'll give you a blood thinner. They're not really treating the root cause, which is this activated state. And it is a treatable thing. And unfortunately, as practitioners, you only know what you come across and what you've been told. And as I said, I was fortunate enough to learn about this early on. But I think there are a lot of people out there that honestly don't know how well they could feel. Okay,
so is this what long COVID is? Is this what long Lyme is? Is this what you think?
Yeah, so I'll answer that to you. First of all, now they're looking at specifically, is this long Lyme or long other things? And because what they're thinking is that rather than the spike protein getting retained in this white blood cell, which, that spike protein isn't in the bacteria that causes Lyme or other tick-borne diseases,
That's COVID, right? The spike protein?
Right, the spike protein is COVID, and that's what, when you got the mRNA vaccines, you were given the spike protein.
So either way, you could get the spike protein either from having COVID or from having
Correct, and
vaccine.
how many times you had COVID and or the vaccines, it's cumulative.
Okay.
So it doesn't really matter. Like, I mean, at the end of the day, to me, I don't care if you had COVID, you have vaccines, how many, let's just treat it, and this is the mechanism that's likely underlying this. And I have looked at other things. I mean, certainly, it's like, another practitioner described as like a web of things that occur. You get mitochondrial damage, you get decrease of the ACE2 receptors, that causes inflammation and also contributes to this hypercoagulable state. There are a number of things that are going on. And a lot of people are using supplements, and they can be effective, but I don't see it as effective as this protocol that Dr. Bruce Patterson and his team has developed. I will still use supplements for sure, but I think that I see the biggest impact in treating it that way. But to get back to the Lyme long Lyme, is that it's like the question is, if the spike protein is getting retained in these white blood cells and that's activating them and causing this inflammatory state in the body, could it be that maybe a piece of the bacteria for Lyme or your other tick-borne disease is getting retained as well, or a piece of the DNA? And they believe that that's what's happening. And they came across that partly because the way they came across is they looked at between 300 and 400 patients who had persisting symptoms after getting COVID or the vaccines. And then they measured 158 different biomarkers, or like markers that could indicate inflammation in the body and different symptoms. And they put that data through computers and basically found that there were 14 of these inflammatory cytokines or inflammatory markers that are involved in this chronic inflammatory response syndrome. And then in time, what they were able to find was, first of all, you see markers that definitely indicate vascular inflammation. And then on top of that, they could start differentiating, well, if you have these particular symptoms, that's going to cause more brain fog and fatigue. But if you have these markers, if you have these particular markers, that indicates a tick-borne disease. And then it's like, if you have these particular markers, it's something else, which they call think maybe MECFS. I think, and they're just starting to look at this now, that maybe it's mold. Mold is a huge contributor to chronic illness. So yes, long COVID, long Lyme. The question is, are you going to be a purist about the semantics? Because long COVID specifically would be, you get the spike protein, now you have this ongoing response to that. At the end of the day, they're using the term post-acute sequelae of COVID, PASC. That's what that means. And with that, it's like, okay, it might not be just from retaining the spike protein. What they found was that if you get COVID and or the vaccine, some people's immune system gets suppressed to the same degree as HIV/AIDS.
Really?
And so if you have these what are called T cells and natural killer cells that are supposed to kill off damaged cells that are normally and get cleared away, but now you're not clearing them off because you're immunocompromised, you're now going to get this uptick in cancers. And that's what they're seeing. They're seeing it even in children, right, this uptick in cancers. Or now you're immunocompromised, and now you're going to develop now these latent viruses, like you had mono when you were a teen, and now you got reactivation of the Epstein-Barr virus. So, and that will contribute to a lot of the fatigue and symptoms as well. So really, it's long COVID, long Lyme. The question is, their research has shown that they have not seen an actively replicating virus beyond 5 months. But could you have a component of the virus or a component of the Lyme bacteria, or name your other tick-borne disease, or perhaps another virus that is now persisting, not in a replicable form, then yeah, that would be a long form of that.
Are you seeing gender distinctions in this either long COVID or long Lyme arena?
That's a really interesting question. I have seen it in both. I don't know. I can't really answer that, mainly because the patients that come to see me tend to be mostly women, but I think that's the case for chronic illness. I think women are more likely to seek out care than men. If you look at the number of men who have atrial fibrillation, I think it's probably, I see more men with atrial fibrillation than women. Now, that's just in my practice. I don't know. It's been studied. Right. And that's the case that, honestly, I don't know if there's a gender difference. I think at the end of the day, it's like, what has affected your immune system prior to this? Maybe you had mold, maybe you had a pre-existing tick-borne disease or virus, and now for some reason you're one of these people that develops this chronic ongoing inflammatory response. That's basically what it comes down to, and I can't tell you the numbers beyond that.
The male and female immune system are different, right? And I think one of the practitioners that we had interviewed in the past argued that because most of the immune system is developed on the X chromosome, women have a different and probably a more robust immune system than men. And I think that certainly bore out during the COVID pandemic, where it seemed that women were able to manage COVID, as a rule, better than men. I may be wrong about that. I'm just making my observations. But what we see, at least in our podcast, that at least Lyme disease is more prevalent in the female community than we see it in the male community. Now, it could be because women seek treatment more than men do, or maybe there are differences in the immune system and the immune response to these different microbes.
Yeah, I'm not an immunologist, but certainly that would make sense. And I think also hormones have a huge impact. You think about, like, hormones are going to affect your adrenals. Adrenals are going to affect your immune system. So, and then you have all these factors coming into play, and certainly hormones are different between men and women. But I couldn't comment more than that.
Yeah, no, and I don't mean to press you on it. I just was making the observation because it came to my head. But this was a fascinating interview. I would really love to do a more long-form interview.
I'd love that. It'd be great. Absolutely.
To got in my co-host who couldn't be here at the conference, who I know would have a gazillion questions for you. Thank you very much for taking the time to speak with us. This is actually a very, very exciting interview, and I think the folks who are going to be listening to this and ultimately watching this are going to be fascinated to compare what you had just shared with us with the last guest, Dr. Haidt, who's a lipidologist, and was talking about the impact that genetic pieces of the Lyme bacteria and the impact that it's having on the inflammatory response and on arterial disease. So it was I think having these back-to-back were just fascinating for me, and I think it's going to be great for our followers. So thank you.
Well, thank you so much. I always love to share my knowledge, especially if it can help people who are suffering.
Absolutely, and I'm looking forward to speaking with you again. Thank you.
Fantastic. Thank you so much.